Last week, I told you about a man who felt everything during surgery and was never told. This week, a hospital, one of America's most prestigious, a teaching hospital for an Ivy League university. 3 surgeons, 3 patients, 3 wrong sides of the brain. 1 year. And each time, they had the tools to prevent it. They just didn't use them. Rhode Island Hospital, Providence, Rhode Island. Founded in 1863, a Level 1 trauma center, the primary teaching hospital for Brown University. By every measure, one of the finest medical institutions on the Eastern Seaboard. In 2007 alone, its neurosurgery team performed over 860 brain surgeries. That is 860 times a surgeon stood over a patient's open skull. 3 of those times, they cut the wrong side. But this story isn't just about 3 mistakes. It's about a system that allowed the same mistake to happen 3 times. About warnings that were ignored. About a nurse who raised her hand and was overruled. And about the question that no one at that hospital seemed willing to answer. How does this keep happening here? Before any surgery on a specific side of the body, surgeons are required to follow something called the Universal Protocol, a 3-step system introduced in 2003. Step 1. Confirm the correct procedure. Step 2. Mark the surgical site on the patient's skin with a permanent marker. Write the word yes directly on the body. Step 3. Call a timeout. Every single person in that room stops. They verbally confirm the site, the patient, and the procedure before the first cut. It takes 60 seconds. It saves lives. January 2007. A third-year surgical resident. An elderly patient. A drain needed on one specific side of the brain. He skipped the Universal Protocol entirely. He did not mark the site. He did not call the timeout. He picked a side from memory. He picked wrong. When questioned afterward, both the doctor and the nurse gave the same answer. They said they hadn't been trained on how to use the checklist. At one of the top hospitals in America, no one had trained them. July 2007. 6 months later, a different surgeon, a different patient. This time, an 86-year-old man with a blood clot on one side of his brain. The surgeon had more than 20 years of experience. Before the surgery, the consent form required one thing. Write down which side of the head would be operated on. 1 box. 1 word, left or right. He left it blank. A nurse in the room noticed. She asked why the form wasn't filled in. He told her he remembered which side. She paused. She asked him again. "Are you certain?" He said yes. He was certain. She accepted his answer. He was not certain. He was wrong. The surgeon cut into the wrong side of an 86-year-old man's skull. He opened his head in the wrong place, on the wrong hemisphere, looking for a clot that wasn't there. When the error was discovered, he closed the wound and opened the other side. That patient died several weeks later. Authorities said the death was from unrelated causes. By now, Rhode Island Hospital knew it had a problem. After the first 2 incidents, new procedures were put in place, new checklists developed, new training ordered. The state health department was watching. They believed the problem was solved. November 23, 2007. An 82-year-old woman needs emergency surgery to stop bleeding between her brain and her skull. This time, the doctor and the nurse go through the verification together. They verbally confirm the side. Left. The bleeding is on the left. They both say it out loud. The chief neurosurgeon then proceeds to open the right side of her skull. He began operating on the wrong side of the brain of an 82-year-old woman. After he had just verbally confirmed the correct side with his own mouth, the nurse did not stop him. The team did not stop him. The procedure continued until someone in that room finally realized what was happening. They stopped, closed the wound on the wrong side, opened the correct side, removed the clot. The patient, remarkably, survived. 3 surgeries, 3 wrong sides, 3 different doctors, 1 year, 1 hospital. Rhode Island Hospital was fined $50,000. To put that in perspective, that is roughly $58 per brain surgery they performed that year. That is what the state of Rhode Island decided the value of accountability was. Wrong side surgery is what medical professionals call a never event. The name means exactly what it sounds like. Something that should never, under any circumstances, happen. There are checklists, there are protocols, there are mandatory timeouts, there are permanent markers. Every single tool needed to prevent it exists. And yet, there is something that stays with me about the second case, about that nurse who noticed the blank form, who asked once, who asked twice, who heard a confident voice tell her he was certain, and who stepped back. She wasn't wrong to ask, but somewhere in that exchange, between her instinct and his confidence, something broke down. The most dangerous thing in medicine isn't always ignorance. Sometimes it's certainty. An experienced surgeon who has done this 1,000 times, who knows the side, who doesn't need to write it down, right up until the moment he doesn't. The universal protocol exists because human memory is fallible, because confidence is not the same as accuracy, because the one time you skip the checklist might be the one time it mattered most. That lesson doesn't only belong in an operating room. Next week on Chronicle, we leave the darkness behind for something different. A doctor who was told a patient had no chance, a family that refused to accept it, and the moment that changed everyone in that room forever. If this case made you think differently about the systems we trust with our lives, subscribe to Chronicle. Because these stories, the ones that make us uncomfortable, are the ones most worth telling.